This is an ultrasound study of a 24 years old married female, bearers, 2 kids. Last kid age is 7 years, and she has presented with the complaint of secondary infertility. Now what we see is that this is the uterus, fundus of the uterus, the anterior myometrium, posterior myometrium, central clear endometrial canal. This is the cervix, seen quite lengthy and large in length, being stretched by the urinary bladder, I think, but otherwise there is nothing significant to be reported in this. And if you note, there is small amount of fluid seen around in the pelvic cavity, with bubbles seen floating within this fluid. Now see this area, concentrate on this area. This is the uterine fundus. This is a very clear endometrial canal in a very early proliferative phase of the menstrual cycle. These are the okay, now concentrate on this region and you will see bubbles floating in this small amount of fluid. And when I move the probe towards the right adnexus, I see, well, let me first show you the transverse section of the uterus. This is the transverse section of the uterus, and this is the endometrial canal. Well, this is the ovary. This is the left ovary, sorry. And we can see the follicle within it. The left ovary measures approximately 2.8 into 1.9 centimeters, and the follicle that is seen within it measures approximately 16.2. So the dominant follicle, but there is discrepancy. That we saw that the endometrial canal is showing early proliferative changes. Here we see a follicle, mature follicle, approximately measuring 16 mm. Anyways, the left ovary is seen. This is the fluid, and now when I move the probe to towards the right side of the patient, I see an echogenic area that extends up to above the umbilicus, up to the epigastric region, and this is the mass, complex, cystic as well as solid. Now these are few cystic areas within it, and these are the cystic areas, small, and you can see multiple tiny internal calcifications. There are thick septas, XY. This is a Y-shaped septa, and this is a very large mass that extends. Now, what is the cystic area? Small cystic area, approximately measuring below the peritoneal line, 17.3, adjacent to the mass in the region of the epigastrium. It is a very large mass, and it extends. So, does it relate to the uterus? It does not seem to be relating to the uterus, as the uterus lining is seen clear, separate, and you can see here it is separate from the uterus. So this is a right adnexal mass, separate from the uterus, a small amount of fluid. Here you see, this is small amount of fluid. and this mass extends, and the mass extends up to the peritoneal region in the midline. Is there, yeah, here this is fluid in the, this is the mass, and this is the fluid in the right paracolic gutter. As you can see, this is the right iliopsoas muscle, this is the fluid, these are the bowels floating within it. Okay. This is the fluid, this is the bowel, and this is the right iliopsoas muscle. So this is the fluid in the paracolic gutter in the same patient. See the complex nature of this mass, cystic as well as solid, and we did see fluid in the right paracolic gutter. See, this is the mass. Now this mass is extending up to the, you can see this is the liver, left lobe of the liver, this is the caudate lobe, and this is the boundary of the complex mass. Okay, now what about the left paracolic gutter? There is no fluid seen in the left paracolic gutter. इधर बेटा मेरे फसल है. This is the kidney. The kidney, left kidney is normal, and this is the spleen. Spleen is normal. उधर फसल है. In size and hypopelvian is seen. Splenic vein is normal. Now this is the liver. Otherwise the liver is normal. This is the kidney. Right kidney is normal. कभी कोई ऑपरेशन वगैरह तो नहीं बेटा है. एक लंबा साल है कि सालों को. Now where is the gallbladder? Yeah, here it is. So the mass does not relate to the gallbladder, to the liver, to the kidney, and this is the lower pole of the right kidney. It's not relating to the lower pole of the right kidney. This is the liver angle, and from here we can trace the mass. Now this is approximately measuring 12.2 centimeter calcification within this mass. So this is a mass of aggressive nature that extends from the region of the this is the uterus again. Now the mass you will see separate from the uterus. It extends from the right adnexa in the midline and then expands on both sides of the right and left, and can be traced up to the epigastric region. Simply look at it. So this does not, sonographically, it does not appear to be a benign mass or a simple mass or a non-aggressive mass. This is the body of the pancreas. This is the head of the pancreas. This is the head of the pancreas. The superior mesenteric artery, the aorta, the liver angle, left lobe of liver in longitudinal section, and this cystic area that we are seeing is possibly representative of cageated lymph node. Yeah, this is a small lymph node adjacent to this solid mass, measuring 18.2 by a bit of generality. And so this is an adjacent lymph node to the mass that we are we have just studied now. So this is our case of the day. With fluid in the dependent region peritoneal cavity as well as the right pericardial gutter. See the complex nature of the mass. You can see small amount of fluid also here. This is the small amount of fluid over here as well. This is the uterus. Again a review. The mass, the transverse section of the uterus with mass. And now this is the uterus in transverse section, this is the urinary bladder, here is a part of the mass, and this is the adjacent enlarged lymph node. Seen at the upper end of mass. This is the uterus. So extrauterine adnexal mass. Extrauterine adnexal mass that is extending up to the epigastric region and expands on both sides of the midline with the upper region adjacent to adenopathy and fluid in the right pericardial gutter as well as in the dependent region peritoneal cavity. Thank you very much.